Hello, I'm Alice Bradley.
And I'm Eden Kennedy, and we're here to talk about childbirth on Mom Ed.
Yes, and in this episode we are discussing C-sections. Do you know what the C stands for?
I don't know.
We're going to find out. We have two guests today. Our first is Dr. Saul Stromer, who has been a practicing OB for over 20 years. He's an attending physician at Lenox Hill Hospital on Manhattan's Upper East Side. Welcome.
Thank you.
And Dr. Stromer delivered our other guests' children. Liz Stern is the author of If You Give a Mom a Martini, 100 Ways to Take 10 Blissful Minutes for Yourself. And she's also a blogger about all things baby. So thank you for coming.
I think I need that book.
Thank you.
Yeah. All right, so you had, your first birth was a regular birth.
Yes.
Nothing untoward happened. And then the second one, you ended up with a C-section.
Yes, I had an unplanned C-section my second time.
How did it go? How did you feel? How did it come about?
I was definitely, I went into the hospital thinking that I was going to have a normal labor, just as I had the first time, and I was induced. I was late this time around, and Dr. Stromer came in and he said, it looks like you might need to have a C-section because the baby is not, it's not taking to the Pitocin, and
It wasn't progressing.
It
Correct.
wasn't progressing.
and I said, okay, we'll do what we need to do and
Get the baby out.
get the baby out healthy and safe and sound. The thing that I find so interesting is that when I'm constantly reading magazines and learning about all these celebrities that are opting to have C-sections, for me, it was a major operation.
Right, that's really important
And
to
people
say.
really don't talk about that. I mean, I was out of commission for 2 weeks. I just was not back to myself. It wasn't just 1, 2, 3. You're up and running the next day.
Right, they're cutting through,
They cut
muscle.
through.
Several layers.
Yeah.
Skin, subcutaneous tissue,
Right.
not in Liz's case, fat and muscle, and then you're cutting into the
Very
uterus.
So how big is the incision? How big are we talking?
You try to do it really over the at the pubic hair line.
He did. He made it beautiful.
Okay. So it's not, in the old days, didn't they kind of just go from stem to stern, just like, what? No?
In the time of Caesar,
In the time of
that's
Caesar.
when they
When
did
he
it that
invented
way.
it, that's what they did.
Correct.
So is that where the name cesarean?
It's thought that Caesar was
thought that
born
was
via cesarean
born that
section.
We're not going to hold you to that?
No,
You
don't
think?
hold me to that.
All right, we'll try
but
not to.
you really try to do a bikini cut incision on the skin, and you want on the uterus a horizontal incision also for the option of a vaginal birth the next time.
Okay.
So anybody who views a cesarean as a simple operation,
They're out of their minds.
it's not a simple operation.
But, TV, they make it look, you watch a baby story, oh, we had a C-section, everyone's smiling, they've got their shower caps on.
And you see, we also see 3 weeks later, we see these celebrity moms back in a G-string thong bikini, and
So what's up with that?
Yeah.
Not 1 ounce
Can
of
we talk about this? Is this
anything.
real? Is that really
Are they getting
happening?
tummy tucks at the same time as they're
have to.
getting
Or are they
stuff?
having
It's
some
not
other women-
advisable if they are,
Yeah.
because you really don't want to do any extra surgery in a patient
Okay.
who is pregnant.
If you previously delivered via C-section, it doesn't mean you have to deliver via C-section again. Some women choose to have a vaginal delivery called a VBAC, vaginal birth after cesarean, but not all doctors will perform the procedure, so check with your individual physician. Reasons to consider a VBAC include fewer complications. You're less likely to get an infection and suffer serious blood loss with a VBAC than a C-section. Shorter recovery time. Avoiding surgery will help your energy and stamina return at a faster rate. Experiencing a vaginal delivery. Multiple C-sections can impact future deliveries. If you're planning a large family, a VBAC may be a better option. C-sections get more complicated with each delivery, while repeat VBACs become progressively easier.
So there's failure to progress is one reason that you might have a C-section. What's another one?
If somebody has a breech presentation, which means either the butt or the feet are coming first, and that baby should not be delivered vaginally.
Well,
Other indications, if you have a transverse lie, if a baby's sideways, you can't pull out an arm and hope for the rest of the baby to
that
follow.
common?
Yeah.
It's very common.
Oh, interesting.
If you have a fibroid, which is a usually benign growth of the uterus, if that's the lowest part and the baby can't negotiate its head beyond that fibroid, that's somebody who needs a C-section also. If somebody has a placenta previa, which means the placenta implants on the lower part of the uterus ahead of the baby.
Implants meaning it's stuck?
It's literally a placenta during pregnancy implants on the wall of the uterus, and it can implant on many different locations.
Oh, I see.
And if it implants on the lower part of the uterus, covering up the cervix, we don't want that person to go into labor. The cervix dilates, the placenta comes out, the baby has no blood supply anymore.
Well, thank you guys so much. This was an amazing amount of
Thank you.
information. It was really
Dr.
great.
Stromer and Liz Stern, wonderful.
Yes.
Thanks for
thank
having
you.
us.
Thank you.
Our next episode is going to be about having your birth outside the hospital, in a birth center perhaps, or at home.
Don't
So
let Dr.
join
Stromer
us.
hear you.
I know. No, we're going to do it at home.